my research broadly, I try to understand resilience in brain aging, and that's really my area of expertise. So there's sort of two ways that we do that. One is by sort of identifying individuals who age really well in terms of their brain. And these are people like your grandmother that you just talked about. And we try and figure out what's their secret sauce that keeps them going. The other way that we do this in my program of research is by identifying behaviors that we know are protective for the brain as we get older. So things like exercise or cognitive stimulation. And I try to determine what's the biology that links those behaviors to brain health. And the idea would be that if we can figure out these resilience factors that your grandmother seemed to have, you know, these could be treatments for cognitive aging or for all types of neurodegenerative disease. So that's really my area of focus. And in order to understand those types of trajectories, we first need to understand what is normal as the brain gets older. And there's been a lot of data on that. So what we see, you know, if you look at a group level of people's thinking skills across age as they develop, we see that there's sort of these rapid gains in thinking skills like memory and language, attention in childhood. They seem to peak in the 30s, kind of mid 30s. But then we do see this group level decline in these thinking skills with increasing age. And that's part of the normal developmental trajectory of the brain. So you might notice things as you get older. I think the most common complaints we hear are just kind of slowed thinking, a little bit more effortful, trying to pull up that word that you're thinking about or recall that memory you're trying to pull out. And those are really common complaints that we have as we get older, kind of considered within the normative range. And then that's much different than the abnormal trajectory. So this is a trajectory where as someone gets older, they take a much steeper decline in their thinking skills. So steeper meaning, you know, within 6 months, a year, a couple of years, you see a much steeper jump in their thinking skills. And often it can occur just in one isolated thinking area. So just in memory or maybe just in language. And that's when we would start to be concerned about an abnormal or an atypical brain aging trajectory. So something like if it was in memory, not remembering a conversation from 10 minutes ago, or, you know, getting lost in one's neighborhood or a really familiar place, that we would expect that to be maintained as we get older. And so that's when we start to get concerned and try and think about what's going on in those abnormal trajectories.